Should we be wearing them? Are there enough of them? If we need to wear them, where do we get them from? Can you make them? And just about anybody who has the ability to donate large numbers of masks to have frontline healthcare workers, we know many people have done that as well already. But then there's the challenge of getting them to other people when they don't have enough masks. My next guests are both doing their own mask making projects. Calandra Li is a first-year medical student at the University of Toronto, and she's actually leading a student project to make imitation N95 masks, and this is for hospital staff to use during training. Lots of training going on right now to ramp up and be ready for doing things under levels of protection, but they have to practice it, so that's going on. Diana von Gruning is a handbag designer, and she shifted her operation to make cloth masks, which she's donating to different essential service workers. Both of them join us this morning. Calandra and Diana, how are you?
Hi, David. Good morning for having me on the show.
Yeah, good to hear you both. And Diana, why don't we start with you? Because you actually put your business on hold and you started making these masks. Why'd you do that?
Well, I really realized on the 19th that I had absolutely everything I needed in my studio to make nearly 1,000 masks, like right off the bat. And so I felt like it was almost my obligation, like I needed to do this right away. I felt like a very strong calling to do this immediately.
How long does it take?
Each mask probably takes around 10 minutes in total. I've had some help, which has been awesome. I've been able to donate nearly 1,000 of them to my community already, which has been great. So I've been working really hard on it. A lot of the time I'm working about 15 hours a day.
Wow, okay, that's a lot. And now I understand you've been able to push out 1,000 of them, but who are they going to?
Honestly, social media has been absolutely amazing in terms of getting people connected in times like this. And so my first connection was made through social media, and it was a friend of mine who has compromised lung function, and I got them to her and her family because they were still going grocery shopping, and she was very concerned for her health. And then after that, I did the staff at the North York Women's Shelter. They reached out to me, and I got a group of nurses at a nursing home, the Richmond Hill retirement residents, Canada Post, everyone just came flooding. It was so fast.
Wow. Okay. Lots of people and 1,000 masks, as you say. Calandra, you're making masks too, but these are ones that are not intended to be used for protection. Can you just walk us through that?
Yes. So the masks that we're making are actually meant to train healthcare professionals. They're not meant to replace real N95 masks in the hospital, but rather they mimic a real mask so that healthcare professionals can practice how to properly put them on and take them off safely.
And what do yours look like? Because they don't need to be at the full level of protection, but they need to still be lifelike.
Right, exactly. So we actually make them using simple shop towels and braided elastics. And we kind of just fold the shop towels accordion style, and then we staple the elastics to either end. So they mimic the shape and the form of a mask, but the actual towel itself is very thin and wouldn't offer any protection in a clinical setting.
I've got you. Okay. But now you understand clinical settings because it's the very thing that you're now studying, first-year medical students. Why is this something you wanted to take on?
Well, so all medical students actually got pulled from the clinical settings. So we're all kind of at home, and I know I feel pretty helpless here, and I know that all other medical students feel that way too. So we've all found different creative, unique ideas to kind of give back to the community and help volunteer. So this is my way, but I know many other students are screening, grocery shopping, babysitting for healthcare professionals. So this is just kind of our way to give back to the hospital communities.
That sounds super. And Diana, you've actually now posted the instructions on how to make these masks on your website. Where is that, and what do they explain?
Yeah, so first off, Calandra, that is an awesome initiative. Congratulations.
Thank you.
We're so lucky to have you at U of T. And so as for the masks, I've actually, David, had 891 mask downloads, which is crazy. So I've posted on my website, which usually is there for my handbags, but I put on a separate tab, and I've posted the download for the pattern, so the shape that you use to cut out the fabric. of the mask, and I've posted some very thorough step-by-step instructions for people at home. I went to college for design, so I mean, I don't need instructions. It comes naturally to me, but I've also taught sewing, and I know that things need to be spelled out, and so I tried to do that very thoroughly for people, and 891 people have tried it at home so far, so that's pretty awesome.
Do you need a sewing machine, or can you hand sew it?
I know a girl who hand sewed them, which is awesome. Good job. And I sew them with a sewing machine.
Okay. It's faster.
Yeah. Yes.
Yeah. Tell us your website.
My website is www.gruning.com/COVID-19. And there you can get all kinds of resources on a lot of the research that I've done. I did a little Q&A on there about just like mask protection and how you can kind of protect yourself if you're going out, and just like the typical COVID-19 stuff that we're hearing on the news today.
Absolutely. Diana, what do you expect you'll be doing a month from now? Is this still going to be the same thing?
Oh my goodness. Well, I mean, I'm hearing that. That's what I'm hearing on the news. And I am prepared to continue to make masks until nobody needs masks anymore. And I want to continue to donate them and offer them for free, because I have no interest in getting rich off the desperation of people in my community trying to protect themselves.
Well, that's terrific to both of you. It's so important what you've both done. So thank you very much. And thanks for explaining it to us. Yeah, appreciate it. That is Diana van Gruning, a handbag designer who shifted her operation to sewing face masks, which she's donating to workers for various essential services. And Calandra Li, who explained she's a medical student at the University of Toronto, and she's making these imitation N95 masks for hospital staff to be able to use in training.